So we've talked about one of the situations where I would use digoxin to rate control AF, which is as an adjunctive treatment where they're already on a good dose of bisoprolol, but it has failed to get the ventricular rate adequately under control. In that situation, I would initiate digoxin concurrently with the bisoprolol so that they would be taking both, and let's see if we can get their rate under control with that. There are two other situations where I use it, which are situations where I would use it actually instead of bisoprolol, rather than as an adjunct to bisoprolol. So the first of these is the situation where an individual has fast AF and their blood pressure is very low. So potentially bordering on hypotensive, so maybe it's 90/60. Now, if their ventricular rate is very fast, this might be one of the things contributing to the low blood pressure, because remember what we discussed in the bisoprolol video. If the ventricular rate is too fast, then the heart doesn't have time to relax back down between beats and therefore isn't going to fill up properly with blood, and therefore stroke volume is going to be severely reduced. So in that situation, rate controlling their AF might be beneficial in bringing their blood pressure up. However, in this situation, I would rather give digoxin than bisoprolol, because bisoprolol, as well as bringing the heart rate down, also makes the heart contract less powerfully. It has a negative inotropic effect, and that reduced force of contraction is going to reduce stroke volume and therefore have a blood pressure reducing effect. So I've written that here. Bisoprolol has a negative inotropic effect, where inotropic refers to the force with which the cardiac muscle contracts. So even if bisoprolol successfully brings the ventricular rate down and therefore raises blood pressure because of that, the negative inotropic effect that bisoprolol is going to exert on the ventricles is then going to bring blood pressure down, and therefore any improvement you get in blood pressure might be limited, or possibly you might even get overall blood pressure coming down with the administration of bisoprolol. So you want to be cautious about giving bisoprolol to someone to rate control their AF if their blood pressure is very on the edge of being hypotensive. We've discussed how digoxin works on the atrioventricular node to reduce the amount of electrical signals that are being conducted down to the ventricles and thereby rate control the atrial fibrillation. However, it also actually acts on all the cardiomyocytes of the heart, and in contrast to bisoprolol, it actually exerts a positive inotropic effect on them, makes them contract more forcibly. So as well as being rate controlling, it's actually positively inotropic. So it means that in this situation where this individual has fast AF and a low blood pressure, it's going to slow the heart rate and hopefully thereby bring blood pressure up that way, but it's also going to mean that all the cardiomyocytes are going to contract more powerfully, and therefore stroke volume is going to increase, and it's going to help to bring blood pressure up that way as well. So it's a very good drug to use in this scenario. So the final scenario where I would use digoxin rather than bisoprolol to rate control AF is the scenario where the patient isn't actually able to take an oral tablet. So bisoprolol is only available in the oral formulation as a tablet. Digoxin, meanwhile, is available both as a tablet but also as an intravenous preparation. So if the patient is currently extremely ill and is delirious and in no fit state to be able to swallow a tablet that you give to them, you need to give medications intravenously, and in that situation you're not going to be able to give bisoprolol. So if fast AF is one of their issues and you want to rate control them, digoxin is the option that you have. So digoxin would be my first line in that scenario as well. Finally, to end, let's just talk about digoxin toxicity. So the most common way in which this occurs is that an individual who is on long-term digoxin to rate control their atrial fibrillation then develops an acute renal failure. So their renal function might normally be quite good, but let's say for some reason they develop an acute drop in their renal function, a significant acute drop, so an acute renal failure, then the drug, which is normally renally excreted, can build up in the bloodstream. This is particularly important if they're on these larger doses of digoxin. So if it builds up to dangerous levels within the blood, then it actually becomes extremely toxic to the heart and can cause an array of bizarre arrhythmias, some of which will be fatal if they develop. We call this digoxin toxicity. In fact, some of you will be aware that digoxin is actually derived from a plant, the foxglove plant, the Latin name for which is the digitalis plant. So this plant contains digoxin and other related compounds within its leaves, and is actually extremely toxic because of this. So when I was a child, I actually had a pet guinea pig that died from ingestion of foxglove. So I put it out in its run for the day, and I moved its run onto some fresh grass, and its run was very large, and I moved it onto this fresh bit of grass, and the run accidentally went over the leaf of a foxglove plant. So it was on the edge of the grass, and it was near one of my mother's borders with loads of flowers in, and one of the leaves of a foxglove plant that was in the border accidentally came into the inside of the run where the guinea pig was. And I, as a child who didn't know anything about gardening, wasn't aware that this plant was going to be poisonous to the guinea pig. So I put the guinea pig in the run, and the guinea pig didn't seem to know that the plant would be poisonous to it either. So it ate the leaf, and it died from ingestion of that leaf. And the reason for that will have been that it ingested a large amount of digoxin and other very toxic related compounds, and they will have gone into its bloodstream and then caused a fatal cardiac arrhythmia, poisoned its heart. So it is poisonous in overdose, and the main way in which people accidentally overdose is that they're on a normal daily dose of the drug to rate control their AF, and then they develop acute renal failure for some reason, which blocks them being able to excrete the drug properly. So overall, it is a fantastic drug for rate controlling AF. It truly is fantastic. It works so well. However, when you put someone on it, do be very aware of what their renal function is before you do so. Make sure that they're going to be able to excrete this drug and it's not going to build up to very dangerous levels. And I hope I haven't scared anyone with the guinea pig story. Remember, the guinea pig ingested an absolutely huge poisonous dose of the drug. Remember the Paracelsus quote, "The dose makes the poison."